There are many treatment options for patients with prostate cancer. Usually the initial treatment for recurrent prostate cancer or prostate cancer that has spread beyond the prostate itself is hormonal therapy. What that means is we give patients treatment that lowers their testosterone level, and testosterone feeds prostate cancer. We typically start with either a surgical procedure or injections that lower the testosterone level, and fortunately about 95% of patients will respond to that. Eventually the cancer figures out how to grow despite this low testosterone environment, and then we need to look to other drugs. At this point there are now new other hormonal agents that we can use. Depending on each patient, with each patient's case being different, we can sometimes use those for several years. At some point those drugs stop working, and then we look to chemotherapy. Chemotherapy is given in IV for prostate cancer. It's given every 3 weeks. Patients tolerate it actually quite well. I think patients are very scared when they hear the word chemotherapy. This is one that is actually very well tolerated, and I've given to men as old as in their 90s, and they do quite well. It works by killing rapidly dividing cells, so it is less specific than the hormonal therapy. For some patients, it is a very good treatment. Every case is different, so some patients end up on chemotherapy earlier because their cancer doesn't respond as well to hormones, while others respond very well to hormones for many, many years and don't need chemotherapy till much later. In addition to chemotherapy and hormonal therapy, there are some targeted therapies that are being investigated that look quite promising. One drug called cabozantinib has worked very well for patients with metastatic disease to the bones after chemotherapy has stopped working. We hope that it will be approved for all patients in the future. There is also much investigation into immunotherapy with prostate cancer, and we have some trials exploring those options as well.